Hello, everyone. My name is Raelan. I have got a really amazing interview for you today. It's with a wonderful woman named Veronique Mead. She is a medical doctor who then became a psychotherapist and now does a lot of work helping people with chronic fatigue syndrome. And this has come from her own journey with this illness. She has lived with ME/CFS for about 20 years, and she's now doing really well. She says she's about 85% recovered, and she's learned a lot. So it's a fascinating interview, I find, for a lot of reasons. I mean, one, just getting a medical doctor's experience. What is that like as a doctor going through this? How was she treated by the medical community? And did it offer advantages or disadvantages with her own health journey? Plus, she's done a lot of work on things like how trauma and different things impact our health and impact healing. So I'm really excited about this interview. It's packed full of information. It's a longer one, but it's time-stamped, so you can jump around, find what you like. I really hope that you enjoy this and learn as much as I did. Hello, Dr. Mead. I know you've told me to call you Veronique, but I still feel a little bit like, oh, that doesn't feel right. Hello, Veronique. How are you doing? Thank you so much for joining me today.
Oh, it's great to be here with you, Raelan. Thanks for calling me Veronique.
Yeah, it's something I grew up with, and it's very drilled into me. I'm like, must call doctors by the doctor name at all time. It feels like you've worked hard for that title and you've earned it. So, but yeah, I appreciate. And we've recently just learned that we are both, even though we're both in the U.S. right now, we're both originally from Canada, which is pretty cool.
Yeah, it's a nice connection to have.
Jump right in. Of course, we have a lot that we want to cover today, but for people who don't know you or aren't aware of your story, it would be great to hear a little bit about your health journey, what life was like before you started facing health challenges and then what happened from there and so forth.
Well, I was a family doctor. When my fatigue started 20 years ago, and I'd finished my training. I'd then worked for a year and a half doing temp work all around the country, which I found incredibly stressful. I was in places for 3 to 6 weeks at a time, didn't know a soul, didn't know the specialists, didn't know the patients. And then I got the job that I'd been looking forward to my whole life, which was in academics, teaching family practice residents and medical students and also seeing patients. And I was there for a few years when my fatigue started, and I'd be fine, and then I'd have a day where it was difficult rolling over in bed at night. I was so tired. And I would drag myself to clinic, do my stuff, and then I'd be fine again. And I'd forget about it. It was so normal. And in contrast to a lot of people with chronic fatigue, I think maybe 40% of us have a gradual onset like I did. And so for me, it got worse over a period of about 10 years. And so at the time that I got sick, I just finished my medical training, where I'd been working 70 to 100 hours a week. And I had the energy I needed to do that, even though, of course, I was tired, but I would recover and bounce back. And I hiked the Grand Canyon with my dad during a time off during that time. And I was biking to work one day, and then I drive home, and then drive in the next day and bike home the other way. So maybe 10, 15 miles. And the way back was up a lot of hills. So I was really active, again, like so many of us, right? And also really a workaholic. I was single, and work was kind of my life. And so that also kind of fits the profile a lot as well. And I ended up going through a really deep process. I was starting to feel depression and grief and something inside that didn't feel right, like a sense of no meaning in my life, even though here I was with everything I thought I'd wanted. And in exploring that, I ended up seeing a therapist, and the sessions I had with him were an hour and a half long. And I had worked with a couple therapists before in medical school when I'd been feeling a quality of depression that was really strong. And then at the beginning when I'd started that job, and this guy was in the alternative world. He was a body worker by trade, but he listened. And we're so used to seeing doctors where we barely have 10 or 15 minutes. And as a doctor myself, I never felt I had enough time. And so this was the beginning of a huge change in my life that I really didn't understand until years later. But the biggest thing he taught me was beginning to listen to myself and my body. And I see you nodding here. And I think in all the work I've done in the 20 plus years since then, this is a huge theme in folks with all kinds of chronic illnesses. Like, we've grown up in situations, often with normal families, sometimes with a lot more than what is actually normal, a lot of trauma. That's the specialty I've ended up with. But in a family system where we might not actually be able to be ourselves, where we might not actually be able to have our emotions if they're beyond or outside a certain normal happiness. And this concept of listening to the intelligence in your own system and getting to trust it and follow it, that was the beginning of what changed my life. And as a result of doing that over probably a year and a half with him, I ended up deciding to leave medicine. I felt as though I didn't really have the tools to work with people other than Band-Aids, other than providing Band-Aids. And so in the long run, or to shorten the whole story, I got worse. I thought it was stress related, but I took a year off and I was worse after a year. And then I saw alternative practitioners. I really didn't think medical folks could do much. I'd done some basic blood work and everything, of course, was normal. And then as things got worse and worse, I retrained as a somatic psychotherapist. That was kind of what I discovered felt like a better fit. And it's been so much more satisfying, and I continued to get worse. And eventually I found a different way of thinking about this that made a big shift for me. But at my worst, about 10 years ago, I was mostly bedridden, housebound for almost a year. I had trouble sitting up for more than 5 minutes at a time. I really had difficulty doing any kind of activity. And so, what a lot of people with pretty serious chronic fatigue have experienced as well.
Wow. Thank you for sharing that. I have so many questions. I'm going to try and restrain myself and not ask them all, but yeah, you shared so many interesting things. Thank you for that. One of them I found interesting, you said, was about 40% of people have the gradual onset. And that's something that I've been very curious about because I haven't seen any research or any numbers on this. And it seems a bit varied from the people that I interview. Mine was very suddenly, but my mother's was quite gradual. So yeah, thank you for sharing that stat. That's interesting to hear. I'm wondering what this was like for you, as it progressed. What did you think was happening? I mean, you have so much more medical knowledge than, the vast majority of people, the rest of us who get hit with this. Did you have any idea what might be happening, or what were you thinking?
Well, as a generalist, as a primary care person, rather than a specialist, like an immunologist, for example, I kind of looked at it and wondered about from big picture, could this be thyroid? Could this be even blood sugar levels? Could this be something to do with my immune system? I did the thing that so many of us do with any chronic illness. You start researching it and looking for it. And it really kept sounding like chronic fatigue to me, just because I didn't have any of the other kinds of symptoms that you might typically find for other chronic conditions. But I ended up really diverging. I think part of it, having been a doctor, I really knew that we don't have all the answers. And I really knew that I was just listening to one of your talks with Katie, who is, I think, an occupational therapist, this concept of chasing symptoms. And I really didn't want to chase symptoms. And I really didn't want to go down this route of one medication after another, lab after lab after lab, doctor after doctor after doctor. And there was this impulse in me that felt there's an intelligence to my symptoms, and I would really like to understand what they are. and I don't want to actually remove them before I can figure that out. I felt as though I needed to listen. And in my training as a somatic psychotherapist, I started to understand and learn about trauma, this concept of adversity. And, you know, our listeners today and people that I talk to on my blog regularly will have a very strong reaction to this. A small proportion of them will get curious, and a large proportion will think, oh, I must be saying it's all in our heads, which is the last thing I would say about a disabling chronic illness like this that I've had too. And what I ended up getting curious about were things I never learned in my own medical training. And that was the concept that trauma is a risk factor for mental illness is more accepted, but it's still seen as an emotional cause for an emotional condition, and that it's psychological. But from what I started learning, it's so much more subtle and so much more pervasive and so much more common than we realize. Because it's not just going to war or being sexually abused, which I had none of that. It's much more subtle. It's even things like not feeling that attachment connection with our parents growing up. Mm-hmm. I think that's one of the most invisible, most common things that we normalize and think we had a great childhood. And then we start to realize that, oh, I actually didn't feel seen or heard as a kid. And so I got curious as to this, and this is still responding to this question about how do I look at this as a medical doctor. I got really curious. Could it possibly be that trauma is a risk factor for chronic illness also? And that's what I've spent the past 20 years looking at. And the amount of research is overwhelming, but it's all in silos. Different diseases, different researchers, different approaches. And what's finally being found is that it's epigenetics, it's life experiences interacting with our genes to influence our physiology and our biology. And that all these different symptoms we can have can be linked to trauma. And this is a new way of thinking about health, behavior, addictions, chronic illnesses of all kinds, autoimmune diseases. And so that has ended up being how I look at it, and that sort of provided a foundation underneath that meaninglessness that I felt as a doctor. It's been a whole different context for me to look at my symptoms, not go into self-blame and shame, and get curious and wonder then from that different perspective of how to work with them as intelligent responses to something.
It's so interesting listening to you talk, because you have such a different perspective from so many of the people that I've talked to and from my own experience. You know, I know for myself, when I first became unwell, I had the attitude that the doctors I was seeing were going to have all the answers, because I thought of them as these superhuman, all-knowing, you know, people that just somehow could fix anything and everything, all with the knowledge in their head. I don't know why I put such unfair expectations on any other humans. But so I think many of us were brought up to just, you know, we're unwell, we go to the doctor. The doctor's going to tell us what to do. But you, coming from the other side, seem to have a better understanding of, you know, they don't have all the answers. Many of this is poorly understood. I'm going to have to listen to myself, listen to my body. I mean, it took me years to get to that place. And eventually that's what got me out of this. Eventually it was, you know, after years of paying attention or not paying attention, just sitting down and just really, you know, looking inside and thinking, what do I know about my body to be true? And what do I believe is going to get me out of this? So it's fascinating to hear how it was a different experience for you because of your medical training and because of your career.
I mean, it's almost like the way you're talking, we came to a similar place of this listening. Like, so is that what made a difference for you? Because you got me curious about your journey too, and what your sudden onset, what triggered your sudden onset. And I don't know if you want to talk about that here, because I know I'm sure you talk about it in other places, but make me really curious.
Yeah, I've talked about it quite a bit, but I could just share briefly that for me, it was just a really bad flu. I was really run down. I got what seemed to be the flu, and I just, I'd get better for a few days and then it would be like it was back. I'd get better for a few days and it would be back. And then it just stayed and then just slowly got worse and worse over, the span of the next few months, the next year. So yeah, it was really, really sudden for me. And I did a lot with doctors and a lot of tests and, spent, a ridiculous amount of money, on different therapies and testing and everything. And it just really didn't get me very far. And it was years later when I finally just like, okay, this is on me. What do I know? I'm going to get, I really had a lot of faith in my ability to know what my body needed. And in the end, that's really what helped me. So yeah, sounds like we did get to a similar place, but you just got there a lot quicker.
Quicker in some ways, slower in others. Yeah. I'm not fully recovered. I'm maybe 80-85% recovered. I can lead a full life. I can run all the errands I need to. I can go on gentle hikes with my husband, which is night and day. I can weed the garden. I can dig holes and plant holes. And that was one of the things I craved. I would look at the weeds growing and I would set the timer and 20 minutes, no more than 20 minutes, knowing that would probably put me down for 3 days, and so I can do those things now and I have bounce back. So if I overdo it, I can recover now. And I do 30, 45-minute walks twice a day at a really good clip. And so huge changes, but not fully out of the woods yet. And I think you talked about, you have a huge exercise routine. You've really fully regained. And I think a lot of people you talk to have as well. And I think most people have an onset after an infection. And we see this in other chronic illnesses too, which is part of what makes me really curious too. And you treat the infection if you can, and then you still don't recover. And how is that possible?
It's interesting too how you brought up how you're seeing the same themes in so many different illnesses and all of these silos. It's got to be such a massive undertaking to try and understand, when it's also segmented, to look at all the information that's out there about things related to trauma. And that's something else when you were talking that resonated with my own story as well, because when I did finally, buckle down at the end and get well, I'd read a book. I can't recall which one now off the top of my head, but it got me thinking about this. And I was thinking, just like you were saying, I'm like, I don't have trauma. I've had a good life and I don't have, but then I sat down and it just in my journal and I started writing down all the heavy things that I was still carrying around. Like, what still comes up into my mind and feels unresolved, or what brings up negative feelings? And I came up with such a long and list of some significant things. So I think that's a really good point, that we don't always recognize what we've been through and how it's still impacting us. So it sounds like from your story, is that dealing with that and addressing that, has that been the primary thing that's brought you to this place of 80% or so where you are now?
Yeah. And I love the way you just described it. Negative things or heavy feelings, heavy things, like that is such a gentle way to phrase it, because the word trauma turns a lot of people off. And part of it is that for 100 years, we've gone into the mind-body split, and medicine is separate now from mental health care. And so as a doctor who was working with physical health, I didn't learn anything about trauma because people thought that it has nothing to do with anything physical. And it's come to the point where doctors still today, I get emails all the time, still tell their patients that it's all in their head if they think that there's a trauma component or that they've had a trauma history and now they have a chronic illness, especially if it's one that's really difficult to diagnose or has no biomarkers, to tell you that, yes, you have this. And so it took me years to realize, I was digging and looking for my own trauma history. It's like, nah, really, it was... I was reading about, there's an adverse childhood experiences study, the ACEs study, published in 1998, which would have been after I finished my medical training, but before I left, right around when I left medicine. And I learned about it maybe 5-7 years later. And now, over 20 years later, this is making headway globally around the world. In the US, California's Surgeon General is an ACEs advocate. They're screening for ACEs in all kids in California. this is actually the research showing that adversity interacts with genes to influence health. And if we have more nurturing and support, especially growing up in our lives, someone to talk to, someone who believes us, someone where we feel really safe, all of those things can counteract the effects. So not everyone who's exposed to adversity gets sick or has symptoms. Mm-hmm. But when I first look at ACEs, there are 10 specific ACEs, and you calculate how many you've experienced, and it gives you a score. And I thought, I haven't experienced any of these. My parents didn't get divorced. I didn't have a parent with mental illness. I didn't have any parent with substance abuse. I wasn't physically, emotionally, or sexually abused or neglected. Like, those are most of the ACEs. Mm-hmm. And then and then also reading the article, it's like, well, and they're not talking about my chronic fatigue. So, none of this applies to me. We tend to really think it has to be very specific and only for our illness. We keep looking for specific causes for each different disease. Mm-hmm. And over the years, I realized that I had an ACE score of 2. And one of them is that my mom had postpartum depression. Like, she told me a couple years ago, she's never cried so much in her life as she did the first couple years after I was born. And there were a bunch of events that happened in her life that triggered that. And I wasn't even thinking of postpartum depression as a mental illness. Mm-hmm. You tend to think of the big stuff, schizophrenia maybe, or bipolar disorder, and that was very sobering to think about that, because a parent who's grieving has a lot more difficulty being able to attend to their child because they're barely making it themselves. So it's not intentional. It's not abuse. And the other ACE for me was emotional neglect. And even saying it here feels like I'm saying something bad about my family, because I know my parents love me. Mm-hmm. But their capacity to connect in an emotional way, in a nurturing way, to actually have a conversation that talks about feelings, that doesn't happen in my family unless I initiate it. And then it has to be the right timing. And then it doesn't go anywhere anyway. And so I gradually started to realize that and see how that had an impact on my ability to connect to others. I can do the short-term connection thing easily, but the ability to connect like in a long-term relationship. I was single most of my life. I've now been married and with my husband for 15 years, and it's wonderful. But that was in my 40s when I met him, And I've been doing a lot of healing around all of this. And part of it that helped me begin to change was beginning to connect to myself. And that's where this learning to listen to our impulses and trust ourselves is kind of cooked into or baked into that as well.
You got me thinking when you're talking about this. I was thinking, one of the reasons I suspect that some of us struggle to think about trauma or how this might be impacting our lives, because, as you mentioned, it implies blame. It implies someone did something to you. And a lot of trauma, when we trace it back, comes to childhood or, our families. And if we come from a loving family, admitting to trauma feels like we're saying we had of that family, or we're putting some sort of horrible blame onto our parents. So yeah, I love that you're talking about it and explaining it in this way. I think it's so important for us to think about all these things in our lives and how they're impacting us, and, to know that it doesn't mean that we, did or didn't come from a good family, or, didn't have blessings in our life.
Yeah.
But we still have some stuff.
Yeah, exactly. Because ultimately these are things that get carried through the generations. So in a way, people might feel depressed listening to me to say, wow, you've been doing all this and you've been doing all this work and it's been 20 years and you're not better. You are barking up the wrong tree, lady. But on the other hand, there are people who have been sick with this disease for 20, 30, 40, 60 years. And I hear from them and they've tried everything. Like, I tried a lot of things, a lot of alternative things. I did not go down the medical route and try all the very detailed things. I actually tried a bunch of things, but also, like so many of us, I had side effects with almost everything. And this trauma perspective gave me a view on that, which I can talk about if we want to, but I want to respond to the blame thing, because that in itself is so traumatizing. To have the medical doctors we go see, who we're trusting, who we feel vulnerable about, who we're sharing our deepest wishes and griefs and pains with, to then have them turn around and judge and blame and shame us is traumatizing. It's, and it enrages me to keep hearing from this. In 2021, I still hear from people all the time who've had this kind of experience. And so when you start to think about trauma from a really big picture, someone to research and look for online would be Dr. Gabor Mate, who's a family physician who is talking worldwide. There's a documentary out now. There is no blame. It's like we actually live in a very traumatized society. If you think about racism and slavery and how we're still a racist community and culture, but it's so subtle, much more subtle at this point, yet still happening. Police shootings of Black men who were unarmed, just as one example, but also the top-down hierarchy in medicine and medical care, for example, when this concept of how we become experts in our chronic illnesses and the research that we do, and yet our doctors don't ask about it. They're not curious about it. They have generally a few short things they can offer or nothing at all. And part of what's been helpful about all this for me has been a desire for medicine to change and an idea of a direction in which it could change that could be so much more helpful. If I had thought of symptoms as intelligent and it had tools, like even the lifestyle tools, lifestyle seems too light of a word, and it seems too subtle to think that diet and mobilization or activity could make any difference at all, especially if it makes you worse, like for us with chronic fatigue. And I'm wandering around, but I also want to come back to, you said how we go to doctors and we expect that they'll have a fix. And I did that with other practitioners. So I eventually, after talking and working with all these different folks, I found a medical intuitive. It's like, okay, none of these other concrete things are working. Can he see something that could be helpful? And it was very helpful. Many, many things he recommended. And then one day he said, you need to exercise for oxygenation. You need to move for oxygenation. It doesn't matter how fast or how far, but you need to do 30 minutes a day. And it was like, wow, that's a lot. But he said, I said, so can I do it in 10-minute increments? He said, sure, however you want to do it. And so I took him to his word. And the first day I did, I went out, and this is when I was in that bedridden year, and I walked around the block. And I was exacerbated and had a huge flare for like 3 days after that. So even the people who you think might be more able to listen are people who you still have to take with a grain of salt. Anything anyone tells you, you still have to check in with yourself. And so this process so many of us have had to figure out with chronic fatigue was, okay, I can't do a whole block. I'll try smaller. I'll try less. And I trust that guy enough, and I'm curious enough about this that I'll try it in different ways. And so doing it in smaller bits, just like with medications and supplements, made all the difference.
I've been really curious, because you and I have been chatting back and forth for a little bit, planning this talk of ours here today. So I'm like, I just have no idea what this would be like for a medical doctor to go through this. And, we talk a lot about doctors in these interviews, and understandably, there are some people who are upset. There are people who have experiences like you've shared, they've been dismissed, or they've been, told things that are just not helpful. But then there's also, a lot of people who are getting a lot of really great support from doctors. So I always try to be careful, because I don't want to be putting the blame or the shame on the doctors either. It's just, humans doing the best they can with the knowledge that they have. But then I wondered, if you come in as a medical doctor, do you have a different experience? do you get taken more seriously? Are you dismissed less? What is that like for you? I know you can't speak for everybody, but for you, what was it like?
For me, I had some doctors who listened really well because I think they are listeners. Mm. And then I had a few doctors, one who treated me as if I was maybe malingering because I had disability insurance and I actually needed to see a new doctor for disability. And when I was a doctor, I hated that. I kept getting new people I'd never seen in my life who needed a signature on a page and I knew nothing about them. And so I'd set it up to help her with that, with a full annual exam and a physical and my full story and enough time so she didn't have to sign it on that first day. And I still felt treated like a malingerer. Like she gave me a list of 10 things at one point and said, you need to leave here saying you're going to do one of these 10 things. But she had no idea, for example, with her prescription of antifungals, that I couldn't even tolerate probiotics at that point from the die-off. So the idea of a die-off from an antifungal from someone who really had no clue about my chronic illness, I went back so I could complete the visit with her, but I brought my husband the second time, And another doctor sent me a letter after I'd done my first visit, and he said, I can't work with you. You used to see so-and-so. And that doctor, he didn't say it all in one, but that was an alternative-oriented family doctor, and I do not want to deal with any of his patients. Was like, oh, wow. And a doctor friend of mine who was a specialist who broke a bone, had surgery, went back because he was having pain after a long period of time where you wouldn't expect there to be a problem. And his surgeon blew him off and thought he was faking it. And he ended up getting a second opinion, and they found out that from a regular x-ray that he had a massive infection. So I think it's really about how we train doctors to listen and not to think of ourselves as knowing all the answers, and that this is part of the system. We have a system that I think is relatively broken. There are people who have managed to get through and stay in medicine who treat us like real human beings. Mm-hmm. And I think a lot of us learn from our own chronic illnesses to see our doctors, even the ones that blame us, as human beings. But it takes a lot of work for us to get there. And it's work that we don't get in medical training that needs to be part of medical training.
Yeah, and I think the unfortunate reality is, like you talked about, how we live in a traumatic world that is still full of racism and all sorts of oppressive behaviors that, medical doctor or not, there are just layers of things that will make us more likely to be dismissed, whether it's, ethnicity or gender or, sexual orientation or whatnot. You'd mentioned bringing your husband in somewhere, and I don't know if this is what you were implying, but I strongly dislike that I have to do this. But when I really care about something and I really need to get something accomplished, sometimes I'll bring my husband. Not to talk, just to be there. Yeah. It changes things. Just having him in the room, I get taken more seriously. And it's
which is crazy to think at this day and age. And I think
I know.
That's an example of, we don't think of that as trauma, but to think of like a negative thing or heavy feelings or experiences, like,
Oh, I really have to swallow my pride in those moments because I really hate that I have to do it. But I'm like, I know, I've seen it too many times to deny that it's going to help. Yeah. Like, can you just come stand next to me and just be a man? Like, just stand there? Okay.
Allies in all our different forms and shapes, right? Yeah.
But anyways, I could go down a huge rabbit hole on this one. I'm getting off topic here.
And I think what you're naming is that I see this as having a context and an understanding so that you can then make a choice instead of being caught in it. And that's how I also see working with trauma. Like, I used to dissociate and get complete brain fuzz and kind of leave my body when I was going to medical appointments. A lot of us do that. Even as a doctor, I did that. And knowing that, I could do things to prepare, whether it was listening to a David White CD on the way, on the drive, or having my husband drive so that I could really just focus on breathing and being in my body, or writing notes. Whatever it is, it helps us prepare. It helps us track our triggers. It helps us know, I'm actually brain fuzzed because I'm triggered right now out of an unconscious old fear response that I'm not going to be seen or heard.
Mm-hmm. Yeah, I think a lot of us put so much into it that medical appointments is a good example. I would rehearse in my head 100 times over because I knew that short amount of time I had with them was so important and I had to get every word right. And just by the time you get there, you're just like, blah.
Yeah. I ended up creating, after many years of this, I created what I call a 1-page medical summary. And I used my medical background to shorten words and summarize things like they're all one-liners. Here's my medical history. Here's my surgical history. Here are the meds. Here's every basic thing you need to know on 1 page. And they loved it. And so I didn't have to remember everything because I couldn't remember everything, even if I wrote it all down, even as a doctor, even understanding my illness. So that says a lot, doesn't it?
Yeah, that's a really good idea, though. I really like that. That's a really good tip. So you've talked a bit about the work that you're doing now, but I'd love to hear a bit more about it. Is this specifically around trauma with people facing, things like chronic fatigue syndrome or what does that look like?
Do you mean in the work that I do, or the work with myself and my health, or?
The work that you're doing professionally now with other people.
So I actually had to stop working as a psychotherapist. I had to stop working as a doctor. I would never have been able to go back. And then I had to stop working as a psychotherapist. And I am doing so much better, but I'm actually not back to a place where I'm doing psychotherapy again. And part of it is that it takes a great deal of what I call nervous system regulation to be tracking my system and then tracking and working with another person's system and helping their system not go off too far. It actually takes more capacity than I have. And so what I do now is I blog and I read and integrate other people's work in science. And this has been my passion for 20 years. And so being able to practice it on myself and then interpret it and put it into a model, I've essentially pulled it together as 8 categories of adversity that influence health. And there's research for every category. So people will have heard of multi-generational trauma. So people whose parents or grandparents were in the Holocaust or in a war or were refugees or were slaves. That has a legacy that persists for generations. And we increasingly understand that there's an epigenetic component of how life experiences actually influence molecules and gene function by attaching to them, and that turns them on or off. And that, I look at that kind of research and pull that together into one arm. And then there's a body of research about pre and perinatal effects. So prenatal stress, women who are pregnant hate to hear about it because, my God, there's stress everywhere in our world. But even Native American cultures, Native American cultures in their health, they know that prenatal stress is not something you want more exposure to than necessary. But if you understand that, then there are things you can do to either reduce the stress or work with it or increase support. But we actually don't have a very good system. Like here in the US, we have the highest rates of maternal mortality in any developed country, and the rates have been rising. And so prenatal stress, low birth weight are actually linked to chronic illnesses later in life. And again, if there's enough support and healing, which is absolutely possible, then that can reduce or prevent risk. But we don't think about prevention in that time frame, even though the research has been there for 50 years and more. And then there's adverse childhood experiences, like I was mentioning before, with the 10 types of trauma. Mm-hmm. And so I look at all those different pieces, and I also look at invisible ACEs, which is the attachment, developmental, impacts of parents who may love us but who have their own trauma or who have to work 3 jobs to keep a house over our heads. I think that's actually the most common under-recognized one. But then there's also, it's sort of like there's a researcher at UC San Diego, Dr. Robert Navio, who talks about this as the cell danger response. And that it's a response that can get initiated as a survival response prenatally or perhaps multi-generationally. And then depending on whether we get enough support or more adversity, if it's out of balance, it can strengthen that survival pathway. And then there seems to be, and this is literature I've seen in all kinds of chronic illnesses, there's this last triggering event. I call it a pre-onset trigger. It's like the last straw. So it could be an infection, and it could be any kind of infection. It could be mild. It could be COVID. You know, people getting COVID long haulers, even after very mild infections with COVID. But it could be something severe like the flu. And it could lead to type 1 diabetes or lupus. It can lead to any kind of chronic illness. And treating the infection for many people doesn't cure the illness. But then there's also psychological or physical trauma or stress or exposure to things like mold or chemicals that can trigger the onset. And Navio's view is all of those things to a system that's primed to perceive threat because of how our experiences have been is like one last threat. Even a vaccine, you know, I got my vaccine. A lot of us are concerned about how to do that with a chronic illness because a vaccine can be a trigger for a chronic illness onset. And it's really, it's asking our system to form an immune response to a threat. And most of our systems can do that just fine. My parents had no symptoms, not even a sore arm. And a lot of us with chronic illness will have more symptoms. I was really, really tired for a month. That perspective fits other people's trauma perspectives. And this is my work, is helping to share this information that we aren't being trained yet as health professionals. So that people with chronic illness, if this resonates in any way, it's really empowering because it means then that anything we can do to decrease the survival threat response can help our systems improve or maybe even recover.
Thank you for explaining all of that. This is really, really interesting. As you're talking, I'm thinking it's so nice to get a better understanding of this. And I think a lot of us look at that, that pre-onset trigger. I can't remember the exact term you used as the problem, whether it was chemical exposure or, mold exposure or Epstein-Barr or something. And we're trying to fix that, but that we get frustrated when fixing that doesn't fix everything. So when we look at the bigger picture of things, for people watching, what does this mean for them? Because we can't go back and we can't change prenatal stress or many of these things. So it is that, like you were just saying, managing that response to it, or what does that mean for people when they're trying to get their health back?
Yeah, that's how I think about it. And that means that, for example, lifestyle changes like diet, like many of us, it took me 10 years to really, really, really clean up my diet. And for me, it was a ketogenic protein diet, low carb, and it just helped a little. And I ended up having to go, I went 0 carb, which was a meat only. It's so drastic. A lot of people will freak out at that concept, but there's thousands of people online who have been doing this for decades. That gave me energy back. It didn't cure it, but it helped. From that perspective of a threat response, anything that can either reduce the threat in your life, so that would be the stress reduction, but also things that reduce the effort your body has to do, so reducing inflammation through something like diet. And potentially reducing threat with, having a cleaner diet that doesn't have as many foods that have been processed. It's things like mobilization can support the system, whether it's through oxygenation or better flow in the system. All of these things, when you think about it from a threat survival response and in looking at it, how do I support a sense of safety in my system? How do I correct for misperceptions? The concept of trauma is that some part of our unconscious in the nervous system, for example, still thinks that we're caught in the past where the event happened. And so all of those pieces, I think a lot of people get familiar with when they've been sick long enough and have done enough research. And if the medication and medical treatment hasn't worked, this is where we all end, is with these kind of perspectives. And what I would add is that trauma therapies and actually working to heal trauma is another piece that we rarely hear about. And so that can mean working with, I would advocate for not doing the talk therapies unless it's someone who is deeply trained in trauma work. Trauma work tends to be working with the subconscious and the unconscious. It's not a conscious thing. And so you can't access it by talking about it or positive thinking or not thinking about it. It's working with sensations and impulses and imagery and the intelligence of the system. So somatic experiencing, or SE, for example, is one type of somatically based trauma therapy. And there's EMDR, people might have heard of, or emotional freedom technique. These are approaches where you're actually healing old relational trauma, often in the relationship with the therapist. It's a long process. It's sort of like everything we hear about with chronic illness. There is no quick fix that I know of. But this process actually helps that survival pathway begin to weaken. And there's things like mindfulness and mind-body practices, whether it's yoga or meditation or Tai Chi. Those are also working with the system so that that survival pathway can start to calm down and shift back, because all of this has reversibility within it. It's like we're not actually completely stuck in this. To what extent can we fully recover? I don't know. I think about someone like myself who's been sick for 20 years. Am I doing something wrong? Could I be doing more? If I went now and tried things, would I be able to tolerate medications better that might help with things? All of that's possible. So I can keep adding things that might be helpful. The mind-body practices and the trauma therapies, my life is so much fuller and better than it ever was before I got sick, even though I'm not completely physically at that place of being, I can't think of what the word is, of being unfazed. But yeah, all of those pieces, it's like the effects of trauma add up to increase our risk of getting sick, but the effects of all the things we do also add up. And, when I changed my diet, it gave me so much more margin and capacity to then add more things into what I was doing for my health.
I love this. And the whole time you were talking, I could feel my body just sort of just calming and relaxing. It's all just, to me, it just all sounds like very good news. It's, things that are within our control. Like we can work on this.
Yeah.
There's stuff we can do. And it's not waiting for some, designer drug to be developed, although that might be the case for some people out there. But yeah. And the importance of just supporting your body and, dealing with that trauma and the lifestyle medicine. I think we need a new term for lifestyle medicine, because kind of like chronic fatigue syndrome, both of them don't sound like something that you should take very seriously, but both of them are serious as crap.
Yes.
So yeah, lifestyle medicine is huge. That is what brought me back to life. It's just supporting my body's ability to take care of itself. It's amazing how these things, taking care of your mental health, taking care of your diet, supporting, your lymphatic system and your gut and all these different things, and moving and stretching and just meditating and all these things that don't sound like they're all that powerful, for me, have been massive.
Massive. And I think this message for people with a chronic illness who get told by their doctors that this is chronic, it will never go away. When they learn about all of these possibilities that we can do ourselels, that's why I blog. It's because it is so empowering. And, the dietary thing, I did it for 4.5 years. like I cheated maybe 10 times in 4.5 years. And the zero carb was really helpful. But in the last 6 months, my willpower started going. And I just got to a place where I really had trouble doing it anymore. And I still had symptoms, but I ended up doing some attachment work, discovering this piece from my family history of anger at my dad around something. And I ended up working with that. And 5 days later, I went out for Mexican food with my husband for the first time in 5 years. And I had done the diet because I had been one of those people who got food sensitivities that were so severe. Like I couldn't tolerate carbs of any kind. I couldn't even tolerate carrots or potatoes by the end. And so I had done this because of a whole bunch of symptoms and also because of food sensitivities. And 5 days later, I went out for Mexican. And yes, I had some symptoms, but they weren't as bad and they were tolerable. And so I was able to work with the symptoms. I was able to practice being with them, meditating with them, doing more trauma work with them, staying calm around them. And I now eat anything and everything. It might help if I were to go back to keto, but oh my God, it's been so helpful to be able to go back. And I don't overdo it. I still eat very clean, but I now allow myself thin crust pizza or an occasional dessert. And I just say that because I haven't lost what I'd gained. Maybe a little bit of energy, but like there's trade-offs and we can work with ourselves to stay empowered with that cycle of how do we do this long term? How do we stay in the game? And ultimately, the way I see it is that our bodies are designed to take care of all this stuff. And the more we can help them shift out of those survival threat responses, the more they do this without us having to work so hard. You know, we don't have to do everything perfectly and things still function the way they're designed to.
That is such a good point. And I never really thought about it that way. You know, I mean, once your body gets stronger, once you get it more in, you know, get your nervous system and everything that I don't fully understand, but, you know, in that de-stress state that it needs to be in to do what it needs to do, then you do have more leeway. And when I was recovering, I was very strict with my diet and, I wasn't 100% perfect, but I was close.
Yeah. Yeah.
And when I wrote my book just coming out of that space, and there's a whole section on diet, and I'm very much like, I nourish my body and it's not worth it to me to take those cheats. And, you know, but that's the space I was in. But lately I feel like a bit of a hypocrite because, you know, my husband and I will go out for dinner on the weekend and have like a bottle of wine and a massive pizza.
Exactly. And it's so much, it's pleasurable.
It really is. And I think, am I falling back into old habits? But it's really not. It's just kind of balanced out. You know, I'm still probably 90% really clean and really good. So I think sometimes the stress we put on ourselves to try and be perfect is worse than the perfect diet. So we have to take that into consideration. And also with all the people I've talked to, not a single person I've talked to who said that they needed to be perfect. And there's so many different approaches to diet. But the one theme I seem to hear is just cleaning it up. Like no one's saying that processed food and a lot of sugar and eating McDonald's every day help them to recover. It's just people have to listen to their body and see what works.
Yeah, it really, this imperfect. It's like, again, it's choice. You know, I feel like I can live life a bit more fully, even if imperfectly, by being able to eat more of what I want, at least some of the time. It's so liberating. And it's like being able to overdo it and push a bit and either do a longer walk or a faster walk or do a bit of a hike. Know that I may have a couple days where I need to rest more and being okay with that because it's not going to be a 3-week thing because that doesn't happen in the way it used to, or 3 month, you know. And so, gaining that more leeway while I keep chipping away at this, as for my area of interest, at this nervous system perception of threat that leaves me in a freeze response, where my body actually needs to be relatively immobilized. That's how it responds to its perception of threat. That's how I see my experience of chronic fatigue. It's not a fight-flight mode. It's actually a withdrawing, hiding, vulnerable protection through slowing down. And that I just keep seeing that and seeing the triggers and working with those and having just options of how I keep working with those.
Yeah, that makes a lot of sense. I think that's really just, what it is, now the bounce back time is quicker. So that pizza and bottle of wine probably still isn't good for me. And I'm still it's not that I'm impervious, like I'm just, I'm strong now. My body can handle anything. But it's just, if you're not doing it too often, your body can bounce back more quickly. And it's better take care of that stuff. Well, I could keep you here all day long, but I suspect people can only watch for so long, and you probably have a life to live. So just kind of as we wrap things up, what else, is there anything else for people who are watching, who are facing things like, long COVID and ME and CFS and fibromyalgia and all of those other conditions that sort of fall under this umbrella that we're talking about? What would you say to them? Any final thoughts or insights or suggestions?
I would say that there is a whole body of people out there who have improved or found ways to manage or work with their health and their illness, whatever that illness is, and to don't give up hope and don't stop looking. There is not likely to be a holy grail single fix for your particular illness. But hey, if you have a really helpful set of health professionals who can do the lab work and you can do that to make sure you've checked a bunch of things, go for it. But in the meantime, there is a lot of knowledge base out there in people with chronic illness who have been finding their way and clawing their way and climbing their way out that can be really helpful to keep supporting your own sense of trust that there must be a way out of this. And I think there's total truth to that. And to keep trusting that in as gentle and kind way as you can. And like, how do we keep holding self-compassion and not judging ourselves? Because this is not our fault. Being sick is not our fault.
Oh, I think that's so important. Thank you so much for that. If people want to find your blog, if they want to learn more about you, where can they do that?
My blog is called Chronic Illness traumastudies.com, and you can find my email there. And I actually really love to hear from people. It's part of what helps me feel engaged. So if you have questions or wonderings or comments, I'd love to hear from folks, and feel free to leave comments here below in the YouTube chat as well.
Oh, that's amazing. I'm sure people will appreciate that a lot. That's really wonderful. I imagine you get quite a few messages. So it's wonderful of you to engage with people and interact with people that way. Well, Veronique, I cannot thank you enough. This has just been so insightful and so helpful. Honestly, truly. I think this is amazing. I think so many people are going to appreciate what you've shared. So thank you for your time. And thank you for doing this today.
Thanks so much for having me here, Raelan. I hope it's helpful for some folks.
Oh, I have no doubt that it will be. And again, to everyone who's watching, thank you to all of you. You guys are so awesome, and all of your comments and everything that you share about your life and your insights. And it's just really wonderful. I think we build such a wealth of information and knowledge in these spaces. So yeah, we'd love to hear your comments and your questions as well. So yeah, reluctantly, I will wrap this up. I guess that's it for today. Thank you again, Veronique. Thank you everyone watching, and see you in the next video.